We were terrified. We knew about 20 minutes beforehand that he was coming. We knew it was way too soon, and we knew if we could make it to 26 weeks, the odds would go way up of his survival, but we just could not make it to 26 weeks with the abruption that I had. Kevin had to be intubated immediately because he was not breathing on his own. They knew at that point that he was too bad to be able to stay in the NICU at St. Mary's. He was going to have to come straight to Cardinal Glennon.
I almost lost Jen, almost lost the baby, and really it's just a blur now. It's still a blur. 2 years into it, we're still going with it.
Kevin started off with a complex congenital heart disease called scimitar syndrome that also has a significant effect on the way that his lungs are formed. In addition to starting off with congenital heart disease that required a couple of surgeries to repair, he started off with pretty abnormally shaped lungs, and because he needed so much help with the heart surgery, being on the mechanical ventilator to begin with caused some chronic lung changes that made breathing very difficult for him just to begin with.
When we were on just traditional hospital ventilation, Kevin had extremely labored breathing. I mean, he was fighting the ventilator. The ventilator would try to push a breath in him, and he's fighting to try to breathe out against the ventilator. And so because of that, they'd have to use sedation and paralytics to kind of take him out of the equation in order for the ventilators to really even do their job.
Before we were able to use this NAVA ventilator for Kevin, he spent the entirety of the day, every day, for months, flat on his back, in a essentially medically induced coma, incapable of any kind of movement, and unable to be awake and breathe adequately. Every time we woke him up, he turned bright blue. This device is a mechanical ventilator that in many respects is very similar to all the other mechanical ventilators that we use from one day to the next. The difference is its sensing mechanism, and that's called NAVA, which stands for Neurally Adjusted Ventilatory Assist. And that sensing mechanism is unique to this device. There's a catheter that goes from the nose down to the stomach. This catheter is very close to the diaphragm muscle, and electrodes on this catheter can sense the electrical activity in the diaphragm when the patient intends to take a breath.
We switched him over, got the NG tube put in his nose, and it sensed when he needed the breath within a microsecond, within the amount of time it took an electrical signal to get from his diaphragm to his brain.
This year, his development has grown leaps and bounds. Our goal was for him by his second birthday to be sitting up, and he's pretty much there now. I mean, he topples still like any kid learning to sit up, but he's pretty much there now. He's pretty much sitting up, and he is working on crawling. If he had somewhere to go, he'd be gone.
He can interact with the world now. He can tell you that he likes what you're doing, or that he doesn't like what you're doing, or that he wants to go do something different. He was able to go outside a couple of times, which we were not able to do before. And that was a ball.
You get the ball? Yeah, you get the ball.
He's able to play now. He's able to interact. He's able to start tasting baby food, something that we haven't done before with him. And so all of these things are stuff that never could have been accomplished without that ventilator for him.
We finally got to see his personality. He hadn't come out of his shell. We hadn't really got to see who Kev was before. We know what he likes. We know what makes him smile. We know where his tickle spots are. We didn't have any of that before. Before it was, is he breathing today? How many times did you have to bag him today? Did he turn blue? Did you have to give him chest compressions? And now it's just, we have a son that we can play with and interact with.
It changed his life. And he's here today, being able to do what he can do because of that ventilator.